Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical
And
therapist.
together, the two of us together think we're the most famous physical therapists on the internet.
Well, obviously, in our opinion, of course,
Probably
Bob.
a little more me than him. Okay, we're going to talk about 5 simple, very simple, but effective ways that you can knock your knee pain down.
Knock it right down to
Right.
the floor.
So we're going to start off with one of the things is the muscle. One muscle that tends to get very weak with knee pain is the quadricep. So in order to strengthen it, this is very simple to do. You can do it in your bed.
Oh,
Brad, here, I can do it.
I'll
here.
get out of the way.
You can just take your pillow, wake up in the morning, take it from your head,
Yes,
fold it,
yes.
put it underneath your knee.
Very good.
Get your knee ready.
There you go.
And you're going to actually push down on the knee and squeeze the knee towards the bed, and it's going to activate the quadricep.
Yep. Think you're squishing that pillow. You're
1,
gonna
2, 3, 4, 5, 6, 7, 8, 9, 10.
Isometric, eh?
Yep. And you could do like 3 sets of 10.
Sure. Start out with one set. You know, hopefully it shouldn't hurt your knee. It's
No.
a reasonably conservative exercise.
This is something that's going to make the pain better right away.
Mm-hmm.
It's going to take a couple weeks because the strength has to get there before
Right.
it does.
Yep.
All right. The next one, Brad, this one could help right away. Is actually, and I know you're going to protest about this, but you should use a cane.
Yeah.
I'd say just try it in your own house.
Use it for what?
To
walk
for
with.
support, yes.
I knew that. We got some stretches we use with the cane, but yeah.
Right.
So that was kind of not a joke, but yeah. So if it's your left knee that hurts, you're going to put the cane in the right hand and just walk, and the cane is going to accept some of the weight, so the knee does not have to.
I have recommended this for 10,000 years, Brad, and I have found out that of all the things I recommend the first day,
Yeah.
this tends to help the most.
Yeah.
And we just had a situation where I went to San Diego with my family, and my daughter Jamie was having pain with her knee.
Yeah.
And I went and bought her a cane.
Yeah.
And she wasn't going to use it.
She wasn't grateful at
But,
first.
oh, she loved it later.
After she used it?
Yeah.
Yep. So, make sure the cane is adjusted right. When you stand tall and let your arm hang down, the handle should come up to the crease of the wrist. This is too short. Simply, and they all have adjustments. Unless it's a wooden cane, then you got to get the saw out. But
Right.
anyways, yeah, they're a wonderful tool. Again, it's oftentimes temporary.
All right. Yeah, exactly.
Yeah.
I mean, you could just cast it aside when you're done with it. But
There you
there
go.
we go. Next one is actually you want to get the blood flowing in there. You want to get the synovial fluid, which is kind of nature's oil lubricant.
Right.
So what you do, what you want to do is every so often when you're sitting in a chair, is just bend and straighten the knee. You could do it for a couple of minutes.
I can't tell you how many patients I've had that had knee pain. I would say if you've been sitting for a while, before you get up and walk, because that's
right,
painful,
exactly.
do about 10 of these and get that synovial fluid moving and get that joint a little bit warmed up, and it can make those first few steps much more comfortable.
And then after you've done that, I want you to go ahead and grab the knee like this and actually bend it into flexion.
Give it a big hug.
Yep. There we go. Hug your knee. Yeah, there we go.
But yeah, sometimes if you grab down here or up this, where you grab the shin can make a difference on that squeeze.
Because some of you out there are going to be lacking flexion, and some of you are going to be lacking extension, which is straightening.
Yep.
So if you have an ottoman or a stool that you can put in front of you, I want you, the final tip is actually work on straightening the knee. Now you can straighten the knee with the foot turned in, turned out, or straight up and down, whichever one feels the best. And you do a little pressure on, pressure off, pressure on, pressure off.
So as I'm showing you, you don't have to have a stool or an ottoman. If
Right.
you can scoot to the edge of your chair, a firm chair is best. And then you can do it like this as well and try the rotation and see which works best. About 10 times.
Yeah, find the one that feels the best, and that's the one you keep doing.
Right.
And every hour or so,
Yep.
I mean, along with the bend and straighten and the bend, you do them all together.
And you'll find, once you get that thing stretched out and you get a little more range of motion, the pain drops down, mobility's easier. It's a good stretch.
We wouldn't lie to you.
Oh, but are we done already?
Yeah,
That's
we're already
5?
done. 5, very simple
Wow.
and fast.
Yeah.
So
That was 5 minutes, a minute of stretch, eh?
there we go.
There you go. Enjoy the stretching.